Okay, so a question that one of our coordinators got this week is, do I perform over the muscle implants or do I only perform under the muscle implants? So let's talk about the different pocket locations and the pros and cons of each. So when patients start researching breast augmentation, they can come across the terms over the muscle, under the muscle, dual plane, and it can become a little confusing. So let's try to clear up some of that confusion today. The most common breast augmentation technique performed in the United States is something called a dual plane breast augmentation. And this is where the upper half of the breast implant is placed under the muscle and the lower half of the muscle is divided where the implant is directly under the breast tissue. So it's actually a partially under the muscle implant, which is the most common. So the dual plane approach is neither completely over the muscle nor completely under the muscle. It's actually a combination of both. And the reason that I like the dual plane approach in most patients is that the muscle allows the implant to teardrop and gives the most natural looking result. I also like the dual plane approach for most patients because our studies to date show that the dual plane pocket location has the least chance of capsular contracture, which is hardening of your breast implant. So the other common location to place a breast implant is actually on top of the muscle. Now, when we place these implants on top of the muscle, it's under the breast tissue as well as under the fascia of the muscle. So it's something called a subfascial placement of a breast implant. So in order to be a good candidate for a subfascial breast augmentation, you have to have enough tissue in the upper pole of your breast, and something that surgeons call a 2-centimeter pinch test. We need to have enough breast tissue in the upper poles so that you don't see the edges and the roundness of the implant. And for those patients, a subfascial breast augmentation can look very natural. I like subfascial breast augmentations in sometimes patients who are bodybuilders, but they have to have enough tissue in the upper poles so that you don't see the implant. The advantages of having a subfascial breast augmentation in bodybuilders is that you don't see the distortion of the breast implant when they're doing certain poses or certain exercises. I also like subfascial breast augmentation in patients who have tuberous breast. It works well because we don't have to worry about the muscle in those patients, and they can get a very natural result with good cleavage. So some patients will ask, if I have my implants placed under the muscle, will I have more pain postoperatively? And that's certainly not true. A lot of my rapid recovery breast augmentations are actually under the muscle or the dual plane approach. So I think both pocket locations can be excellent options. Talk to your surgeon to see what option is best for you.